reason is diseases of respiratory system. So in these two questions, you only talk about myocardial infarction, stroke, anything you know. You know these diseases better than us because you're right now studying internal diseases, and you know better than us these diseases. Oh, yeah. So these two questions are familiar to you, so you don't have any problems with it.
Okay, thank you very much.
This is nothing forensic medicine here. You should know that this is an object of forensic medicine because when in cases of a sudden death, we don't know the reason of that, uh, how the death occurred, because and that is why we perform an autopsy.
Yeah, exactly.
Yeah.
Okay.
Because if we don't perform autopsy and there are no traumatic injuries, etc., we say that this person has died of cardiovascular and respiratory failure. Well, it is right, but there is some other reason for that, not just cardiovascular and respiratory failure.
Yeah.
Yeah. Are we waiting for anybody else in order to start? Because we have a lot of things to discuss.
Yeah, we can start and they can join earlier if they want.
Okay. So, first of all, 2 weeks ago, I've shared with you the whole new syllabus for the exam. Did everybody knows the new ones?
Yes, doctor, we have.
Okay.
To everyone.
Okay. And also the very last question about material evidence. It is out. You should not learn it.
Okay.
About the material evidences.
I think it's not such as a big deal. I mean, it's easy also.
It is easy, but we talk about with it with Dr. Hajiev, and well, there are a lot of questions, and it is not necessary to learn this.
But also, how it's gonna be the exam? How many questions will have? 2?
Okay, I will explain this. So first of all, 2 days, Saturday and Sunday. Half of you should come in Saturday and half of you on Sunday. Let's say 2 groups at 8 o'clock and the other 2 groups 8:30, as you wish. It doesn't matter. Some colleagues had written email to me that some of you want to come on Saturday instead of Sunday. There is no problem at all. Don't ask me about this. We will not. We will examine everybody, so there is no problem. Come when you want.
Okay.
No problem. Second of all, about the exam. Well, 3 questions from the theoretical syllabus. 1 from traumatology, which we will discuss today. 1 from toxicology, that you have listened to this lecture today, and 1 from the third part of the syllabus about batteries, etc.
Yeah.
Yeah. About the toxicology, I've shared this secret with some of you. We don't actually need you to know any details. So this is for toxicologists. This is not actually forensic. this is not an object of forensic medicine in details. Forensic toxicologists deal with these poisonings, etc. So for the exam, write the questions at home and use it on the exam. This is what you should do, if you want, of course. Read it, write it, etc. This is for the toxicology. From the traumatology, we will discuss it.
So, doctor, about
Yes.
the toxicology, we don't
Yes.
need the doses or these things. Like we need just like the main causes or
Yes, you should know only the most important things. Even the doses, that little doses, you shouldn't know it. We don't know it, actually. I don't know it. Don't know them. There is no point of knowing these things. Write all the most important things. 10, 15 sentences the most. We want to know what is the poison, how the poison affects the body, which system affects,
okay.
and how the clinical picture and the corpse pictures looks like.
Okay, yeah.
Always the most important. There are so many unnecessary information on the lecture, so write, read, learn the most important things. This question, the most important question actually, is the traumatological one. And for example, if you have batteries, severe stage, moderate, and mild, these are the most important things for us. This is the forensic actually questions. So these are the most important questions. And there is a practical question. I've shared the syllabus with you, but as you can see, there is no additional questions. All the questions from this practical syllabus are questions from the theoretical one, but in this case, we want 1-2 sentences and that no more. The most important thing.
Okay.
Not the whole question to be explained, etc.
So, doctor,
yes.
How many practical questions?
One.
Okay.
And it's the same basically with the theoretical one.
Absolutely.
Yeah.
You can see it. Open the file.
Yeah.
There is no additional questions.
Mm-hmm.
It's the same. Let me see. Yeah, defensive wounds. Do you know what defensive wounds are?
We saw a lot of picture actually, but we don't know how to.
So let's start, if you want, with the traumatology. The forensic traumatology divides into 3 big groups. Injuries from what? Hard, blunt objects.
And fire guns.
Fire guns, and the third one?
Sharp objects.
Sharp objects. Okay, let's start with the hard, blunt object. Well, first of all, do you have any questions about the very first questions from the about what is forensic medicine? You know this. I mean, there is nothing special here. Objects, corpses. Let me just see some of you about the battery questions. Well, what kind of injuries? Because some colleague just asked, what can you tell us what we should know about battery questions? Well, you should know that there are 3 stages. We classify the stage of the battery as severe, moderate, and mild. And you should know that we classify injuries into one of these 3 groups. Well, if you want, we can just tell something about batteries for a little short time. What is heavy damage, severe stage of battery? Which conditions we say that they are heavy damage?
We said constant deafness, blindness.
Constant
speech.
deafness with the 2 ears, both ears.
Yes.
Constant blindness of one or both eyes here. Yes. What else?
Loss of speech.
Yes.
Loss of some organs.
Okay.
Reproductive disability.
Permanent.
Permanent, yes.
Okay.
And we talk about the permanent general health disorders,
Mhm.
making the difference between severe and average. With
Yes.
the severe,
What is the difference?
the difference is if it's severe, 100% chance of death when we don't have any medical help. If it's
Yes.
average, we have a 50% of chance.
Okay.
With
And how it is named the average stage? The moderate stage condition?
the average battery, you
Yeah,
mean?
yes, but the condition, because the severe stage is permanent general.
Injury.
What?
Didn't we call it temporary dangerous to life injury?
A permanent health disorder, but not
Yes.
life-threatening.
Yes. No. This is this is one of the conditions that is not life-threatening, and the other one, temporary.
Temporary, yes.
Yes, temporary life-threatening. And we make difference between permanent general health disorder that is life-threatening, which is heavy damage, severe stage of battery, and temporary health disorder that is life-threatening, but temporary, not permanent, and which is moderate battery. The difference here, you said it. If there is 100% chance of death, of lethal outcome, if not medical help is given, this is the severe stage, permanent health, general health disorder that is life-threatening. And if there is a 50% chance of not dying and 50% chance of death if no medical help is acquired, this is moderate battery. Did you understand this?
Yes.
Are you sure?
Yeah.
And give me examples. Give me examples of permanent general health disorder that is life-threatening. This is the severe stage, the heavy damage.
Like the fracture of the base of the skull.
Yes. Okay. What else? Aneurysms.
Brain abscess or
Yes. Post-traumatic epilepsy. Spine injury. Okay. But with, yes, spine injury. Okay. And give me an example of temporary health disorder that is life-threatening.
Like a brain contusion.
Absolutely. Brain contusion, like we discussed last week. Brain contusion. Why? Because if you experience brain contusion, there is a 50% chance of develop hydrocephalia, brain edema, etc., epileptic seizures, and with a little outcome. But there is a chance of, very high chance of, not dying. So this is temporary, life-threatening, but not permanent. Okay. So for the exam, you should know the conditions.
Sorry.
Yes.
For example, temporary hair loss and this.
Yes, this is moderate, because
moderate.
they are not for the lifetime. They are not
temporary
permanent.
blindness and deafness.
They are moderate stage.
Okay.
Yes. Remember this: when we talk about heavy damage or severe stage, as you wish, name it as you wish, we talk about such conditions that are for a lifetime, with no chance of going back and live healthy. And when we talk about average or moderate stage, we talk about temporary conditions, but more than with duration more than 30 days or 1 month, but not permanent, not for a lifetime. This is the main difference here. This is what you should know about the batteries. The conditions in the 3 stages, and this is it. I mean, nothing special. All information is on your lecture. Well, you should maybe give some examples. For example, like we said, for the permanent general disorder, etc. Give examples, and that's it.
Yeah.
Tell me the conditions in moderate damage. Which conditions are moderate injury?
You mean like reduced vision or hearing?
Absolutely.
Difficulty in speech,
Reduced vision, reduced hearing. Okay.
Well, this is moderate, yeah. Not permanent.
Not permanent. Yes, but tell me the conditions. This is what we want.
Difficulty in speech, not loss.
Jaw fracture.
What fracture? Jaw fracture. Yes. I want to make. I want you to make difference between 2 things. Difficulty in movement of the limbs, which is moderate injury, moderate stage, and loss or mutilation of leg or hand, which is heavy damage.
Severe, yes.
What do you think? How these things differ? First of all, loss of leg or hand. This is the amputation. It can be surgical, or it can be traumatic amputation. This is the loss. What do you understand by mutilation of leg or hand? What is mutilation of leg or hand?
Like you cannot really walk very well. Like you lost one of the limbs.
It's when the extremities lost their main function.
Absolutely, the main function. There is no amputation, the full amputation of leg or hand. Maybe there is no amputation at all, but loss of function, the main
Ability
function.
to walk, yeah, very well.
For the lower leg, the ability to walk, and for the hand to catch things, to grasp things. It can be because of some neurological injuries or amputation of what? Which fingers
We said that
participate in catch function?
thumb and index.
Thumb
So
and
if we don't have
index.
the
So if we have amputation of thumb or index finger, this is severe stage because we have lost the main function of the hand. And if we have lost, for example, the small finger or any other of the three left fingers, this is average, moderate stage because the main function is still here, still there. You can catch the bottle, for example, if you don't have a small finger, right? So this is mutilation when the main function is lost. It can be because of some neurological conditions or amputations, etc. But the main function isn't there. So, for example, if well, did you understand this? This is easy.
yes.
Okay.
I think the most difficult part is part 1 with all the mechanical damages. That's the confusing part.
You mean what? Traumatology or?
Yes, the traumatological part.
Okay. So, did you understand the batteries and the mild batteries? There are two conditions there. What are they?
We had like a heavier condition with health disturbance, but not dangerous to life. For example, a laceration wound that they can get infected, and a milder condition like pain or suffering. And we talk about the difference, like a pain experience of a unpleasant feeling, while suffering extending pain.
Yes. Okay. And about the moderate stage, it includes injuries penetrating into a cavity, cranial, abdominal, etc. Breaking one of two ribs, yes, this is mild condition. This is mild condition. And it is not pain and suffering, but the other one. Not dangerous to life. Okay. About the moderate damage, injuries penetrating into cavity. Why this condition is life-threatening and why it is average, moderate damage, but not mild?
Because there can be a penetration in internal organs or the big vessels, or it can also lead to infection, sepsis, which are all these life-threatening conditions.
Yes. The very first reason is if we have penetrated some important organs, internal organs. And the other reason is, for example, if we haven't affected any organs, but there is a contact. There is a contact between the internal and external ambience. So it can be infected with bacteria, etc., which can lead to that. And this is why this condition is, injuries penetrating into a cavity as a moderate damage. Is anything unclear about batteries? Ask me if you haven't understand something. They're easy. There is logic in these things. You should find the logic here. Why some conditions are more dangerous than others, why some injuries are severe, why some injuries are moderate, and why some injuries are not dangerous to life. They are mild stage. for these questions, we want you to know the main conditions for the 3 stages. This is what we want, and we can ask about the batteries if, for example, you're between 2 marks, and if you want the bigger one, the higher one. So learn this. These are important questions, and that's why if you haven't understand something, ask me right now. I will help you on the exam. This is not a problem. I've told you many times that you will take the exam, but I want you to make things clear for you.
I think it's okay, yeah.
Okay, so let's move on to the traumatology questions, because I didn't know that you have actually experienced some hardness for these questions, because they are hard questions. These are these are the most interesting questions. I don't know.
For me personally, the most difficult one was the second part about this toxicology and all this poison.
Well, toxicology, and that's why I told you, write the questions for the exam. You think that I know the toxicology questions? Well,
that was my concern, to be honest. But
there is no problem for the toxicology questions. Dr. Hajiev doesn't know these questions also. Yeah. And also the other lecture from today about DNA analysis and blood groups, etc. Personally, I know only the AB0 blood groups, as you actually. For the forensic medical expert, and for you actually, the most important here is to know how the samples are taken from the scene, crime scene, and that all the evidence must be examined. But we don't examine these material evidences. We send them to some other experts, biologists, immunologists, and etc. So for the exam, you should know the lecture, but only the most important thing. These are stupid things. Stupid question.
Okay, yeah.
You should know AB0 blood group, because you be doctors, and all of you must know how to manage with group blood samples, etc. So, traumatology.
Yeah.
We said that there are 3 groups: hard blunt objects, sharp objects, and firearms. What do you remember for the hard blunt objects?
I mean, like for the hard blunt objects, so we have to check this.
What are hard blunt objects? You should always tell the what they are.
Objects with flat surface, blunt edges, and with a spherical cylindrical shape.
Okay. Give some examples.
Like a hammer, for example.
Okay. Hammer.
A book, a pan, a punch, example.
Okay.
A chair.
Chair, yes. Maybe. The floor, the wall, also surface hard blunt objects.
Not sharp.
They are not sharp, absolutely. Hard blunt objects are those who are not sharp and are not firearm.
Okay.
Yes. Okay. In what mechanism they act? What are the mechanism of obtaining damages with hard blunt objects? What are the mechanism of action?
They hit,
compression.
Okay. They press, they can break, they can rub, they can crush.
Stretching, friction.
Yes. Okay. And can lacerate, absolutely. Okay. Tell me what kind of injuries hard blunt objects can make. What kind of injuries?
Hematomas.
Abrasions, bruises, and contusions.
Contusions. Okay. What kind of wounds they make?
The lacerocontusive ones.
Laceration wounds or lacerocontusion, yes. Okay. And what else? These are the main morphological lesions which are caused by hard blunt objects, but what else?
Like, should we describe all of them? Like, if we talk about bruises, like saying suffusion, sugillation, petechia, chemosis, and so on?
Well,
or
bruises or suffusions, this is the same.
Yeah, but like, I don't know why like it was listing them like that. So it's fine just if we will say bruises and we will make the distinction between petechia and ecchymosis.
Oh, no, you should know that petechia are just smaller ones.
Smaller than 2 millimeters.
Yes,
okay.
But that's it.
Okay.
And, for example, about the bones, Yusef had written fractures, of course, fractures.
Oh.
Ruptures of internal organs, for example. What else? On the bones?
On the brain, maybe on the head. Contusions of the head.
Contusions of the head. And about the brain, okay, about the brain. What kind of injuries about the brain do you know?
Hemorrhages, hematomas, commotions.
Commotions, okay.
Smash.
Do you know the difference between brain commotion and brain contusion?
Yeah.
Tell me. Which is the heavier injury?
Commotion.
No.
No, contusion.
Brain commotion is the smallest brain injury, the lightest one.
Okay.
Yes, and actually, brain commotion without loss of consciousness is considered mild injury. When we talk about batteries, it is mild injury, but brain commotion with loss of consciousness in the moment of the injury, it is moderate injury when we talk about batteries, because loss of consciousness in the moment of the injury, of the brain injury, because this is a brain injury, right? This is a life-threatening condition, because you may don't recover from the unconsciousness, or may, for example, experience epileptic seizures after the commotion. You may develop cerebral edema, etc. These are life-threatening conditions, but brain commotion without loss of consciousness is a light injury. It is a mild injury, mild damage. Well, for the exam, I don't know that if you should know this, but you should know that brain commotion is the lightest, the most small brain injury. But brain commotion is life-threatening condition, so it is heavier injury. What is the difference between commotion and contusion? Can you explain? What is contusion? We experience contusion, I'm sorry, from hard blunt objects, from the wall, from heat, from right? So, what is contusion?
It can form a bruise, a hematoma.
It absolutely it can. It is not necessary, but in most of the cases, there is a hematoma. Yes, it is right. And what is commotion?
It's the concussion.
Concussion, yes. So, did you understand why they are different in way of well, the one is heavier injury and the other one is small injury. Okay, so we said brain commotion, brain contusion, hematoma, hemorrhage. How many hemorrhages, brain hemorrhages, do you know?
Epidural, subdural, arachnoidal space.
Yes, perfect. Okay, and about fractures? Many. You say many.
The fraction could be in one place, in two places, could be in open wound or closed wound.
With displacement and stable fracture, which is non-displacement of the fragments. And if there is no fracture, but fissure or cracks, do you know cracks and fissures of the bones? Not fracture, but
yes, the linear ones that sometimes can't be seen even with the X-ray.
Yes,
because they're very light.
Yes,
the tears.
Okay, and the very very last one, injury caused by hard blunt object, is all kind of ruptures of internal organs. If you remember, when we discussed road traffic accidents and the damages of internal organs because of the higher kinetic energy, and in many times, for example, there are no external damages, no external injuries outside of the body, but inside it can be there can be ruptures of internal organs, which are life-threatening ruptures of which internal organs are life-threatening.
For example, the heart.
Absolutely,
that's the
heart,
first one.
Brain,
liver,
and the abdominal cavity,
liver,
and
a pancreas for the release of the enzymes, autodigestion.
Yes, but pancreas is not ruptured so easy. Which two organs in abdominal cavity are the most
Spleen, maybe?
What?
Spleen.
The spleen.
Spleen, absolutely, and liver. These are the two most dangerous abdominal internal organs that can rupture and lead to death. Spleen and liver. Yes, Yusuf. If you want Yusuf talk, don't write. As you wish. Okay, so all these kind of injuries we discussed now, they are caused by hard blunt objects. Let's start from the difference between what are abrasions and what are bruises or suffusions. Okay, Yusuf, don't worry. I will check the chat. What is the difference between abrasions and bruises or suffusions? First of all, what are abrasions?
Abrasion is when we're actually damaging the integrity of the skin.
But which layer of the skin?
Like epidermis and dermis. It's very rare,
Yes.
like rarely we reach the papillary layer.
Yes, the superficial layer. Yes. Okay. And what
with the bruises we have the
yes. Still?
We have the breakage of the blood vessels. That's the main concept.
Yes, and the blood vessels are outside of the vessel, and they form
an extravasation.
and they form the spot, or it's not just the spot, but the homological picture of the bruise of suffusion. And you should know that bruises, they differ in color. In the moment of experience the hit by a hard blunt object, what is the color of the bruise?
It's red, then it's going to become yellow, then green, and then brown.
Yes, and
it can also be black after some time. More
black.
Darker brown, I mean, like
darker, yeah, dark. Yes, okay. Okay. Did you understand the main difference between abrasions and bruises? Do you find it difficult?
Yes, we understood.
Okay. What are laceration wounds and how they differ from the other kind of wounds, which are? What are the other types of wounds? What?
Contusion.
Contusion wounds or laceration wounds, they are the same.
Okay. So it's the rupturing of the skin.
First of all, when we talk about wound, we talk about well, there are many types of wounds. Well, not many, but in case of hard blunt objects, this is laceration or lateral contusion wounds. But in case of sharp objects, there are how many types of wounds when we talk about sharp objects?
4.
4 types. First of all, how a laceration wound looks like. Imagine some hard blunt object that acts on your hand, for example. It's first of all, you said to me the mechanisms of action.
Mm-hmm.
Can we describe it like as a tear in the skin, a laceration?
Laceration in the skin, okay.
Like
each wound has 4 elements. What are the 4 elements of each wound?
The shape, you mean?
The shape, yes, the shape of each wound. Elements of the wound, or the in order to shape.
The
edges,
angles, walls. Yes.
Edges, bottom. Edges, bottom.
Walls. Angles.
And angles. So, describe to me the laceration wound by these 4 elements.
Let's say that they're not sharply demarcated, all of these, compared to the sharp wounds.
Yes. Okay. It is right. And?
It then depends on the how it's penetrating in about the organ that you will use in order to.
Can you repeat the question? Because I didn't understand. Okay.
Is it how is formed this wound? Like from which thing that is?
Well, each thing, all the objects, but hard, blunt ones, they are basically the same. That's why they are under the whole this group by objects, hard, blunt objects, right? So the mechanism of action of all these not sharp objects, you know, they make the same kind of laceration wound.
Okay.
So
we have tissue bridges.
Tissue bridges, absolutely. Do you remember what tissue bridges are?
Not exactly.
Okay, imagine some knife which divide and divide the when first of all, imagine one knife. Okay, on the skin. It divides the perfectly and cuts the tissues perfectly and divides it, right? But when a hard blunt object, for example, one rock or hammer acts on the skin, it smashes the skin and the tissues under the skin, and many times it leads there are left tissue bridges. These are parts of the skin which are from the one part of the wound to the another. Did you remember the tissue bridges, how they look like? This is basically not cutted skin. This is tissue bridges.
Yeah.
Like you
Yes.
mean parts of skin that are crossing over?
Yes, they cross over the whole wound. These are tissue bridges, and they are only typical for laceration wounds or contusion wounds. This is the same. They are not typical for the other types of wounds caused by sharp objects. Okay, laceration wounds have tissue bridges. Okay. How look like the edges of this type of wounds? Imagine the mechanism of action.
They're not well defined. They're irregular.
They are irregular, absolutely. They are smashed. They are bruised. The edges are bruised because of the blood vessels which are smashed. Okay. How the angles look like?
Round.
Okay, they can be round, but some of the cases they can be sharp, but the most of the cases they are uneven and they are round. How the lows look like?
Well, we said with tissue bridges.
Okay, and they are also they're also they are they have the blood vessels smashed, so they are blooded.
Blood clotted or something.
Yes, blood clotted. Okay, and the bottom. The underlying structures are mixed. What do you mean you say by mixed? Many times the bottom is polluted and it is also smashed, it is polluted, and because of the mechanism of the action of the hard blunt objects, these kind of wounds, they like smash together. Yes, absolutely, Yusef. These kind of wounds, did they bleed? Do they bleed?
No.
No. Why? Because the blood vessels are smashed, right? And they are, how it is called? They are, there is a hemostasis, coagulation of the blood vessels. Because they're smashed, they don't bleed. So these type of wounds, laceration blood wounds, they don't bleed. This is different in cases of the other kind of wounds. For example, in cyst wounds, they bleed a lot. Okay. Basically, this is the most important things you should know about hard blunt objects. Ask me something, ask me if you haven't understand something about hard blunt objects.
I think everything is clear.
Okay.
Yeah, we come to the hard, to the sharp.
You find it hard.
No. I said we can continue to the sharp.
Okay.
Sorry.
Okay. How many, what type of sharp objects or sharp weapons do you know? How many types? We said that there are 4 types of wounds caused by these kind of weapons. So there are basically 4 types of
yes,
weapons.
like stab weapons, cutting weapons, puncture cutting or stab cutting, and chop down weapons.
And chop down weapons, absolutely. Let's give some examples. Stab weapons. Pure stab weapons, not stab cutting. Pure stab weapons.
Like
fork.
Fork, yeah.
Absolutely, like fork. Okay, like a hook.
Yeah.
Yeah.
Nail.
Stab weapons are those who have, which have a pointed tip, but they don't have cutting edge. These are pure stab weapons. And they cause what kind of wounds? Stab wounds.
Stab wounds, yeah.
Absolutely. Okay. The other type, we said
Cutting.
Cutting.
Knives and
a razor.
Scissors.
Okay. And they cause, yes, Yusef. But I'm sorry. What kind of weapons? What kind of wounds called
cutting wounds?
Yeah.
Cutting or incist wounds. Okay. And the combination between stab and cutting?
Puncture and cutting.
Puncture and cutting or stab cutting, as you wish. Okay. We have here combination of pointed tip and a sharp edge, sharp cutting edge. So, absolutely the most popular weapon here is a knife.
Yeah.
A knife. And it causes, when acts perpendicularly to the skin, it causes puncture, stab cutting wound. Stab cutting wound. When acted perpendicularly, 90 degrees to the body. But, for example, the same knife can cause a cutting wound if acted tangentially, superficially, tangentially to the surface of the body. So,
I have a question
yes.
about these wounds, because I saw it in the slides and I wrote it down. It was written for the stab cutting wounds that it is good that to break down clothes, it is good that breaks on clothes should be cut sufficiently to the side and fixed on the filter paper. And I didn't understand this. What does it mean?
This is a method. First of when we have such case, it is absolutely necessary to examine the clothes of the victim. So we can, for example, cut the part of the clothes that has damage on it, and in order to understand, we always compare the damage on the clothes to the injury, the wound on the body of the corpse, if there is a corpse, of course, in that person, because the person can be alive also. So we always compare the damage on the clothes and the injury caused on the body. This can be made by cutting the damage part of the cloth and put it on a paper in order to measure the damage, the part of the cloth that is damaged. These are some methods, but I don't know.
It's like, I don't know, there is a wound in the chest part and the man is wearing a t-shirt. So we take this t-shirt and we cut the part where the stabbing part was made, and we take this piece of cloth and we put it in a filter paper, like to measure it, or how does it work? It's not we shouldn't know it.
Well, you
Can we
shouldn't
skip
know it? Of course, you should know that we investigate, we examine actually the clothes also, the damage on the clothes also.
Okay.
Then
I will leave it like this.
When we have, because of we talk about wounds here. I've told you that when we perform an autopsy, it is absolutely we don't have to, because if we have the knife, for example, the knife which we know that is the knife that is caused the wound, we never put the knife back into the wound in order to see if they matches. It is absolutely irregular to do. It is absolutely you shouldn't do this, because there is a chance to you for you to devastate the wound in this case. So there are some materials, some substances. They look like a wax, for example. We put on the corpse. We put the wax into the wound. They dry out, and this is how we measure the depth of the wound. There are some methods with some liner, but special liner, which we can put into the wound, but very carefully. But the most used method is those wax methods. We put the substance into the wound. I'm sorry, my cat is visiting me. We put this substance into the wound, but never the knife, in order to see what is the depth of the wound. Did you understand this? These are methods of examining all kind of wounds.
Yes, it's like we're feeling a cavity, like to get an impression of it.
Absolutely. Yes. We get the imprint of the wound in this way.
Okay, it's clear.
Okay. And the fourth type of sharp weapon weapons?
It was like the chop weapons, like
Chop
an
weapons?
axe.
Absolutely, and they form-
swing and strike.
they swing. Absolutely, this is the mechanism of action with the swing. Absolutely, because if there is no swing, they can act absolutely as a cutting weapons. If tangentially and carefully and slowly act tangentially into the superficial layer of the skin, they can act as a cutting weapon. But when act with the swing and strike, this is the chop wounds. This is how chop wounds are made, and they are deeper. They can actually, how deeper can be chop wounds?
They can cut everything. They can cut also like bones.
Absolutely, they can. There can be fractures, etc. They can decapitate. Absolutely, Youssef. Okay, and they are heavy weapons. Imagine one axe. They are heavy weapons. Not, for example, knife, which is a lighter weapon. It is important. They are heavy and large weapons, and they act with a swing. Okay. Stab wounds. How do they look like, stab wounds? Imagine one fork. Small opening, but deep. Well, yeah, it can be deep. Yes, small opening. The opening, the most of the time, is oval or circular. It depends on the shape of the weapon, but yes, lack of tissue bridges. But this is important to tell this when we talk about cutting wound, incised wound. Artemis.
It's regular, like straight, no?
For which wounds you talk about?
Stab.
Stab wounds.
Yes.
First of all, imagine one fork which acts on the skin and the tissues. How the wound look like? We said that the opening, the part of the wound that we see is oval, circular.
So we will have an entry part, which will be oval.
We have entry part
and a channel.
And sometimes wound channel.
And sometimes an exit, but not all the time.
Yeah, because exit you can have, for example, if there is a stabbing wound on the hand, for example, or on the leg. But in most of the cases, there isn't an exit. So, okay. Tell me how incised wound or cutting wounds look like. First of all, they don't have any tissue bridges. Sharp corners or angles, yes. They're sharp. How the walls, we said about the walls, how the bottom looks like. Yes, Youssef. We can say that they are longitudinal on the surface. What is the bottom here? We said that on the laceration wounds, the bottom is polluted. It don't bleed. It is smashed. But here
it bleeds. Here
it bleeds
the
because the tissues are perfectly cutted. the vessels are perfectly cutted. Triangular bottom. Well, why triangular? It's not necessary to be triangular. The bottom is clear. The bottom bleeds. This is the most important here. Okay. How the stop cutting wounds look like? They are deep, but also on the outside they are. How do they like?
They are well defined, like the margins are very sharp, well defined, and they can be deep. And if we want to measure, for example, I don't know, the size of the knife, what we should do is we measure the deepest part of the wound, because sometimes we can penetrate the full knife or partial of it. So we measure the deepest, and then we measure the smallest diameter part, because we can rotate it sometimes.
Absolutely. See, you know everything. These are
only two things. There is a lot about all these wounds, and I don't think I can remember, or we can remember all of it. And I don't know if they're gonna ask all of it.
Well, the most important things, what we discuss now, this is the most important things, etc. And well, these things, but with some more sentences, you know.
It's like we will say the same things, but we will try to make it nicer.
Yes.
Okay.
This is important for every single exam. Okay. Tell me, is everything clear with the sharp weapons and wounds? You should make the difference here between laceration wounds and cutting wounds, because stabbing wounds and contusion wounds, they don't look absolutely they don't look alike. So is everything clear with this question?
Yeah, I think we can go to the
about the chop wounds. We should just say that it can damage everything, like skin, muscle, and bones.
Yes.
And we're gonna leave it like that. Should we describe more, or it's fine in this way?
What do you mean?
For the chop wounds, since we described a lot all the others, like the stab, cutting, and so on, for the chop wounds, should we just explain the mechanism of swinging and striking, and just saying that it can cut off all types of tissues, and that's it?
Yes, absolutely. This is absolutely enough.
Okay, perfect.
And there is a strength you need to act with the strength, with the swing, in order to cause a chop wound, because like I said, one axe can cause only superficial cutting wound, right? But when acted with a swing, it can cause severe damage. Like Yosef said, it can decapitate. So this is enough.
I have a question about all these wounds. Do we have a differentiation based on scars and tissue marks, or?
First of all, when we talk about wounds, we say that it leaves a scar. When we have wounds, they leave scars. So this is what you should know. They leave a scar. All types of wounds, they leave a scar. Can you tell me about your questions once again, because I wanted to tell you this. So,
for example, like as an end result, after months, if we're analyzing something from a blunt object wound and a sharp object, we're gonna have different types of scars and tissue marks, right? should we know them, or it's fine just to leave it like that?
It's fine. Well,
Okay.
you tell that there are different shapes, because there are different shapes. The objects that you act with, they have different shapes. For example, fork. It leaves a typical picture, typical wound. For spots. For imagine one fork, for example. So
Okay.
yeah, they are different shape. This is enough. Okay. Anything unclear for this question?
No, I think we can move to the firearm.
Okay, firearm. This is no one of my not favorite questions, because I don't really. This is boring for me because I'm a woman. These firearms. These are male question. They the males understand this better than the women. So first of all these kind of firearm weapons, you shouldn't know them for the exam. Only you say that there are different types of combat weapons. There are hunting weapons. There are sport weapons, and give one or two examples. That's it. This is the not important part of the questions, the types of the weapons. There are different types of firearm weapons. So first, you should know what you should know. You should know how the first. You should know how the cartridge. What is the cartridge? Tell me. What is the cartridge?
There
I
are
just know it's a combination of 4 things. That's it.
I have faith in you because you know everything.
No.
The bullet
Like
plus some powder, said Yusef.
Yeah, it's like we have a capsule with a shell and a projectile and the gunpowder. These 4 things combined.
This is okay. These are the parts of the cartridge. Okay, there are different types of cartridges, combat, special, etc. Okay, and detonator, said Yusef. Okay. What is the capsule? What is the capsule? It consists of what? Where it is, the capsule? It is on the bottom of the cartridge.
Yeah.
And it contains what? The gunpowder, right?
Mm-hmm.
Okay. What is the shell?
The shell is the around of
the upper part, the covering part.
The shell is the cup.
the bullet, let's say.
No, the bullet. The shell is the cup with all the ingredients of the cartridge. And what is projectile? Projectile is basically what?
The bullet.
Basically the bullet. But in order for you to get the exam, you say projectile, not bullet.
Okay.
I'm kidding. Okay, this is the projectile. And where it is placed? On the neck of the shell. There are different types of projectiles or bullets. As name them as you wish. How the shot is made. How the gunshot is made.
Doctor, you mean the mechanism of the projectile, how it's shooting?
Yes, the shooting.
Well, expansion of gases behind the detonation in the capsule.
Okay, and
then the projectile is released.
With okay. Okay. Yeah, basically that is it. This is it. How many? Well, there are 3 actions: mechanical action, thermal action, and chemical action. When we talk about shooting. Sorry, my cat is speaking. Okay, what is the mechanical action? Imagine how hard blunt objects act.
It's like the striking, or
what is the mechanical action on the skin, on the tissues?
They heat it and then they try to penetrate it.
Pressing on the skin.
What on the skin?
Pressing,
yeah. Compression, pressing on the skin. They tear the skin and the tissues. Okay. What is the thermal action? Because of the hot gases and the flame.
Yeah.
Okay. And what is the chemical action? Because of the combustion of the gases. When we talk about combustion, what kind of substance?
the soot.
CO2.
Yes, carbon dioxide, and that is why the tissues are reddish in the wood channel when projectile is penetrating the skin. The tissues are red because of the carbon dioxide. Okay. Tell me, how many distances do you know? Because we have
the close range,
close range,
long range, and distance.
Okay, close range. Yeah, I agree. The other
wasn't also the
long range, and there is also point blank.
Yeah, point blank or contact. Let's say contact. It is easier. Contact range, close range, and distance or long range. Okay. This is important because there are different types of injuries caused by the weapon, the fire weapon, from the different ranges. First of all, let's talk about contact or point blank range. Imagine, well, tell me, contact range. When we talk about contact, it means that the weapon is where?
Attached to the skin.
Attached to the skin.
Yeah.
Okay, and
the barrel will be marked on the skin.
Yes, how it is called this? Stamp, like a fingerprint. It is stamp. It imprints the barrel, the weapon on the skin. Okay. And how the wounds would look like?
There's also the residue of the powder, right, on the skin?
So, first of all, how many contact wounds are they? There are two types. Whole wound, whole contact, full contact, and the other type is
Partial contact.
partial, absolutely partial. When we talk about full whole contact, it means that well, we forget to tell something about additional factors. What are additional factors? Which are additional factors of the shot?
If we have
the flame, the shoot.
Yes, that is what I mean. Flames, okay. Gunpowder. Yes. So these damaging factors, when we talk about contact range, they have influence on the wound. So when we have whole contact wound, imagine the projectile. Well, imagine the entry wound is like a it's like a continuance to the barrel of the weapon, and all these additional factors that we just said, they act in the entry wound, and that's why from the gases, for example, the tissues will be reddish. It can be some deposits from the absolutely, the powder is completely inside the body when we have a whole contact wound, Yusef. Absolutely. And when we have partial contact wound, the powder will be outside of the wound. Well, some part will be inside, of course, but the other part will be outside of the entry wound. It is typical also that the entry wound, when we talk about contact wounds, the entry wound will be larger than the exit wound. This is when we compare, for example, contact wound with a wound caused by distant range. In case of distant range, it will be the exit wound there will be larger than the entry wound. I will explain this why is this when we talk about distant range. But remember, when we have contact wound, the entry wound is larger than the exit wound. Okay. How the close range wound will be will look like. In this case, we also have the action of those additional factors: gases, powder deposits, gunpowder deposits, etc. How the close range wound look like? Imagine all these factors outside of the wound. Small hole and gets greater in depth. Well, yeah, but here the exit won't be bigger than the exit than the entry wound, Yosef. It is not necessary to be.
Can they be alike in the close range, or?
Well, in most of the cases, they are same as contact wounds. The entry is bigger.
Okay.
But it is not necessary. It is not necessary. So here, don't compare exit and entry wounds in close range. Don't compare them. In close range, you should know that the additional factors, they're outside of the entry wound. We will have particles of gunpowder. We will have gases because of the effect of the gases. They will be also they will have influence on the entry wound as well. The entry wound will be circular, for example. It can be reddish. The angles can be reddish because of the gases of carbon dioxide, etc. And when we have distant range, here the exit wound will be bigger than the entry wound, because when the bullet is inside the body, it pushes pieces of tissues and organs or fragments or fractured fragments of the bones with itself, and that's why when releasing the body, the skin, the exit wound will be bigger in distant range, and no action of additional factors here. Here acts only the bullet. Did you understand this? Here acts only the bullet, and the exit wound is bigger than, so only mechanical. Yes, only mechanical.
Sorry, doctor, can I ask you to repeat how is the entrance in a close distance and the exit?
In what distance?
In a close distance.
In contact distance. In contact distance, it is the entry wound is bigger than the exit wound, and in distant range, the exit wound is bigger than the entry wound. In close range, it is not necessary for the, well, it depends. In some cases, the exit wound would be bigger. In some cases, the entry wound would be bigger in close range. So we don't compare here. In case of close range, we don't measure the exit and the entry wound.
Okay.
But for contact wounds, the entry is bigger, and for distant range, the exit is bigger.
Okay, thank you.
Okay.
How should we describe for like the distant range the entrance part, except that it's smaller than the exit part? Here we're not gonna have a reddish color, right?
In distant color.
In the distant range wound.
I'm sorry, in the distant range. Yeah.
Yes.
I'm sorry. Well, it will be reddish because it will always be, well, red, etc. But it is because of the mechanical action, because of bleeding, etc. But not because of the thermal action of the gases and carbon dioxide. This is the main difference. So it won't be so reddish, because carbon dioxide is really reddish substances. Google it and you'll see. It leaves very red color on the skin, which is not the same as for example the red from the bleeding one. So they differ.
Okay, so it's like a paler red compared to the other two.
Yes.
Okay.
Yes. When we talk about entry wound, for distant range, we talk about minus tissue. It is important to tell this for the exam. The entry wound is with loss of tissue. It is called minus tissue for distant range.
So is it the same concept that you told us, like the loss of tissue that then it's dragged with the bullet till the end? Or?
Yes,
Okay.
and that's why the exit wound is bigger.
Okay.
Yeah.
So in the long range is bigger than the close range?
Yes.
Because
the exit is bigger.
really
The exit is bigger, but for the entry in contact in close range and distant range, we don't compare them. But the exit will be bigger. Yes.
I think it depends on the gun because, for example,
absolutely depends on the gun as well. But it depends on the range also. Yeah.
If it's the bullet is too big, for example, 7.40 something is a millimeter, and like if you shoot from a close range, you will not see a body at all. Like you will see some meat.
Absolutely depends from the. Yeah, it depends. Yeah.
Also, if it's too long the distance, maybe the wound is gonna be too small because it's too the distance is too big. You know?
Yes, absolutely. If it is very, very, very long distance, it can just brace the skin. You know, there won't it not always. We don't always have entry wound, exit wound, etc. By the way, how it is called when we have exit wound, entry wound, but we don't have exit?
It's a blind shot.
Blind shot, yeah. Okay. So basically, this is it. I think that you, on the practical questions, you have 3 questions. One for the close range, one for the long range, and one for contact. So with just 1-2 sentences, you should describe them.
Should we describe the injuries caused by it based on the viscosity of the tissues? Because there was a part about the high viscosity of the brain.
You should know them, yeah. You should know them. Well, you should know that they differ in cases of parenchymal organ, etc. You should know that there is a difference, but well, tell this for the exam, but yeah, okay, tell this. Okay. What else? For the firearm injuries, the 3 types of distance, they are important. Hunting weapons.
Exactly.
Hunting weapons. What are hunting weapons? Tell me. Give me an example. For example, what hunting weapon?
Guns.
Guns. What kind of guns? Rifles.
I'm not familiar.
Rifles.
Okay.
Rifles, hunting weapons. Yusef, we are talking here about firearm hunting weapons. Machete is knife, big knife. Yeah. So here you should know that. Here you should know that these kind of weapons, they act with high velocity, and the damage here is bigger when compared to not hunting weapon wounds caused by non-hunting weapon. The different types of projectiles. For example, what kind of projectiles are typical for the rifles? What types of projectiles? What are the projectiles here? They are not bullets, but
Like
they
bayonet
are.
or something like this?
What did you tell?
Bayonet.
Units, or what?
It's like a big knife, but with the weapon, actually.
I didn't hear you at all. Talk a little louder, please.
It's like wait, I will show this.
They are not bullets, but they are shots, bows, a little small ones, circular ones. In Bulgarian, we call them sachmi, but in English, I really don't know how they are called.
Okay, I just Googled it, the types of projectile in hunting, and it said there are 3 types: bullet, round bow, and shot.
Round bows and shots. This is what I meant.
Okay.
Yeah, they are different from bullets, and most of the rifles, they act with these kind of projectiles. Yeah.
Carolia, can you repeat it, please?
Also.
Yes, it was like 3 types of projectiles for hunting weapons. The first one was common bullet, then round ball, and the third was shot.
Okay.
Thank you.
Yeah.
No problem.
Okay. Ask me something else for firearm injuries.
I mean, for this hunting part, there is not that much to say. Can we just make a general discussion about the firearms injuries, and then we will talk about the hunting part, just to say more?
Well, this is enough. Well, they can cause well, more severe damages than guns. They are used for hunting. They this is the same. Well, they can also be used from a close range, from a contact range, and from long range. And also the additional factors are they can they have influence in close range. The different thing here is the projectile, basically. And because of the form of the projectile, the circular one, it is not necessary to have an exit wound, which is the same as the other kind of guns, but because of the form, the circular form. Well, imagine one bullet and imagine one small bow shot. They have different form, different shape, and sometimes, not sometimes, but more often, when we are talking about hunting weapons, we don't have any exit wound. So this is the other difference. And of course, you should know the questions. I didn't talk about this, but the main questions to the expertises, not just for the firearm injuries, but injuries at all for all of the questions. So learn this also. Okay, what else we can say? Let me
I
just
think there is only explosion after this.
I think explosions.
And temperature, low and high temperature, the degrees.
Yeah. Okay. First of all, vital signs, because I'm looking at the syllabus. Vital signs of traumatic injuries and cause and genesis of death. Do you know these two questions? Have you read them?
Yes.
Yeah.
Okay. Let's say these are short questions, just the most important things. What are vital signs of injuries?
Those are like signs that are happening during an injury, and they can be general. Yes, and they can be general or local. For the general, it was mentioning only the bleeding and clotting, while for the local ones, for example, bruising, inflammation, and then we can describe them.
Okay, let's start from the most obvious one. When we have bleeding, when we have blood clotting, this means that they are vital signs. Why vital signs? Because this means that we had the person, when he had this injury, he was alive. He had a heart activity. Yeah, you said that's right. To prove of life of the victim, when the same victim was injured in the moment of the injury. So bleeding, blood clotting, these are signs of vitality. Also, when we talked about hard blunt objects, we talked about suffusions. You should know, first of all, that always when we have fracture, the tissues around the fracture will be what? Bruised, suffused. This is absolutely vital sign. Suffusions are vital signs. So, imagine, for example, on autopsy, we can broke some bone. The tissues around the fracture won't be bruised, absolutely, because there is no blood movement, there is no heart activity, no blood circulation. This is why bruising, suffusions, they are they are vital signs, absolutely. So bleeding, clotting, suffusions. What other?
Emboli, for example.
Absolutely. No, that man has ever experienced embolism.
Aspiration of blood.
Absolutely. Why aspiration of blood is a sign of vitality?
Because it's a sign of breathing.
Absolutely.
And also swallowed.
Absolutely, because this is
sign of swallowing and movement. So
yes. When we talk about aspiration of blood, it is necessary to see on the autopsy aspiration zones with blood red zones on the lungs. This means that the person had been breathing when the injury occurred. But when we find blood, for example, only in the bronchi or trachea, etc., this is not sign of vitality. It is necessary to find aspiration of blood in the lungs, in the parenchyma of lungs. This means aspiration of blood, not only on the bronchi, etc., but lungs. This is aspiration. This means that the person was breathing. Okay. What?
And
yes?
And based on the swallowed blood, there was the difference based on the site where we were finding the clots, for example, in the stomach or in the intestine, to know how much time the victim was living or not after the injury.
Well, yeah, we can interpret this, but there are some other signs of when the death has happened. So, but yeah, you're right. Absolutely. If there was a blood in the stomach, the death had been occurred a couple hours ago. But when it is on the intestines, for example, it is a little longer. So, but there's some other marks, signs in which we consider the time of death, not from the swallowing of the blood, but yeah, it is. You put logic in here, so yeah. Okay, some other vital signs.
Inflammation.
Inflammation. All inflammation conditions. What are the processes of inflammation?
What do you mean?
Necrosis.
Yeah.
Okay.
Granulation.
Yeah.
Yeah.
On dead people, we don't have granulations. We don't have redness, inflammatory processes at all. Okay. Okay. Tell me about what? Tell me about reason and how was the question actually? Let me see. Cause and genesis of death. First of all, can you make the difference because of what is a cause of death and genesis of death? What is the difference? What is the difference?
The cause is one. The genesis can be multiple.
Absolutely, you're right. The cause is one. The genesis is, well, what is the cause of that? This is the basically the type of injury received that caused the death. And what is the genesis of that? This is the mechanism of how the main injury led to the lethal outcome. So this is the pathogenesis actually of the death. This is the difference between cause of death and genesis of death. I want to give this example here. The cause of death, for example, when we talk about incised wounds on the neck. Imagine one incised wound on the neck. The genesis of death, well, this is the cause of death, right? But the genesis of death can be three types. First of all, imagine incised wound on the neck. What can be the cause of that here, the genesis of that here. First of all, the person can die from bleeding if some big vessels
Hypovolemic
are,
shock.
yeah, but this is from the bleeding. So the first is bleeding. The other one is aspiration, right, of the blood. Aspiration, bleeding, loss of blood. The other is aspiration of blood and die from asphyxia. And the third genesis of that here is what?
Infection with sepsis for the wound.
Sepsis,
Or
but this is like
even though it's
it will it is not soon after injury.
Embolism?
Embolism, of course, air embolism. Yosef, what was the example you asked? Imagine insist wound on the neck. This is the cause of that, right? But genesis of that can be 3 types. The first type is, death from bleeding, from loss of blood. The second type is blood aspiration and die from asphyxia. And the third genesis of that is air embolism. So this is an example when we have one cause of death, but different pathomechanisms, pathogenesis of death. So this is the difference between cause and genesis of death when we talk about mechanical factors. In this question, we talk about how many causes of death are there. There are 2 types of causes of death. Let me just see how they were in English. The very first is immediate cause of death. Yeah, Francesco, that's right. And late. And the late causes of death, they're from the complications of the very first immediate cause of death, of the injury. So let's talk about immediate cause of death. What type of immediate cause of death? What kind of injuries lead to immediate cause of death?
like big traumatic injuries, for example,
Absolutely.
Decapitation.
Absolutely.
If you cut the head.
Absolutely. And what else?
Massive bleeding.
Bleeding, okay. Let me just, because I'm out of battery of my my phone, to get my charger, but I'm listening to you.
So like smashing.
Smashing, okay. Big traumatic smashings, amputations, etc. Okay, these are not these are life-threatening conditions that can lead to immediate death. Concussion of the brain. No, Francesco, concussion of the brain is like a commotion of the brain, which is not considered heavy damage.
Mild battery.
This is mild battery when we don't have loss of consciousness. Oh. Tell me, for example, one trauma of the ribs.
Or for example, if we stop of breathing.
Why stop of breathing?
And for example, If you cover all the airways, for example.
Pneumothorax, hemothorax,
Pneumothorax,
yes, Yosef and Katya, absolutely. Okay. The first of all was smashing parts of the
Asphyxia,
body.
for example.
Asphyxia.
Hmm.
Asphyxia. Yeah. Okay.
Yeah, that was I was mean. Yeah.
Okay. Yes. Yes. Fast blood loss. It is also immediate cause of death. Fast, but not a slow blood loss, but fast blood loss. How many how many liters of blood is there in the human body?
5 to 6.
Absolutely, 5 to 6. What blood loss we considered? We consider fast blood loss, which is life-threatening.
Like 3 liters?
1/3 percentage, absolutely. Artemis, absolutely. And Panagiota, I'm sorry if I haven't told you your name correctly. Yeah, 1/3 of the blood. This is when this 1/3 of the blood is lost fastly. It is life-threatening condition, which in the most of the times is lethal. Okay. We said hemothorax, pneumothorax, hemopneumothorax. Okay. What else? Asphyxia. Okay. Brain concussion with loss of consciousness. Brain contusion with hematoma, and rupturing of hematoma can also lead to death. What else? How many embolisms do you know? How many embolisms do you know?
Air embolism, fat embolism.
Okay. You know what are these embolisms, but it is important here to know the fat embolism. What is fat embolism? What is the mechanism of developing of fat embolism? Yeah, from fractures. Okay.
It's after fracture, if fat particles are getting into the blood circulation.
Mm-hmm. Absolutely. This is fat embolism, and it is most common on the long bones like tibia, fibula, femur, etc. But fat embolism can be developed from any fracture on the bones. But
are we considering it as a late cause of
no,
death?
No. It is not late. It is immediate.
Okay.
It is not late. Late, for example, embolism will be thromboembolism as a late cause of death after fracture, if not anticoagulants are given to the patient. For example, in this case, thromboembolism is late cause of death. If the fracture is, if the patient hasn't been given anticoagulants like Fraxipirine, Clexane, etc. This can lead to thromboembolism, right? It's a late cause of death. Okay, tell me now about late causes of death. I told you the first one.
Infectious.
Let's divide the late causes of death, the complications, because they, in the most of the cases, they are complications, the late causes of death. They are infectious and non-infectious. Let's start with the infectious one. Okay, infection. All kind of infections, you know. Sepsis, gangrena, meningitis, pleuritis.
All of them.
It is very lethal condition. Contusion pneumonia after chest trauma, for example. Contusion pneumonia. And the patients die actually because of contusion pneumonia if the initial injury, if he don't die from the initial injury, he dies later from the contusion pneumonia, which is late complication. Contusion pneumonia. Yeah, these are infectious reasons of death, late reasons of death. What are the non-infectious? I told you the first one. For example, thromboembolism
Rupture
after
of
fractures. What?
Rupture of an aneurysma.
Absolutely. Rupture of aneurysma.
Traumatic epilepsy.
Yes.
Crush syndrome.
What is the late cause of death when we talk about Crush syndrome? From what the patient dies when we talk about Crush syndrome?
Renal failure.
Absolutely, renal failure. Yes. Why? Because when we have fracture, we have myoglobin, which causes the renal failure because it binds to the kidney system and it leads to renal failure, the Crush syndrome.
And also all the things that they are related with the spleen and the liver, maybe.
From the Crush syndrome?
No, in general.
In general, yeah. This is it. For this question, cause and genesis of death, you tell what is cause of death and what is genesis of death, and you talk about immediate causes of death and late causes of death, as known as the complications from the initial injury. Nothing hard.
Doctor, because we mentioned before that about the explosions, I think you said they are not in the syllabus question, right?
Explosions. I think we deleted this question.
Yeah, we deleted the question. We had only the firearms.
Yeah.
These vital signs and then the mechanical drama, the ones that we.
Yes.
Okay.
I thought about. I thought that we deleted also the hunting weapons because there is not so information about this, but yeah, I think absolutely you don't have to learn this.
Okay.
About the hunting weapons.
Mm-hmm.
So only the three claws, the three ranges.
Mm-hmm.
Yeah. Okay. Thermal trauma. Let's talk about
the low and the high temperature.
The low and high temperature. It is basically the picture is the same. The clinical picture of high and lower temperature is the same. Let's start with what? What do you want? Tell me.
High.
High temperature. Okay. What are the 4 degree of how is called the high temperature action, local action of the high temperature.
Combustio eritematosa.
First of all, combustio in Latin. This is the local effect of high temperature. Okay, let's talk about the 4th degree here. The 1st degree.
Combustio.
Combustio eritematosa. Okay. How it is? How it looks like? The 1st degree.
Redness of the skin.
Yeah.
The swelling around the.
Yeah. Okay. And the 2nd degree. There is formation here of what?
You have blisters.
Exudate.
And exudate, and A or B depends.
Yes.
Blisters. Bulls.
Of blisters. Yeah. So we here have redness with the blisters. Yeah. Full with what? The blisters. What they contain?
Exudate. Inflammatory exudate.
They're exudative substance from blood components, lympha, etc. The 3rd degree.
It's the combustio escarotica.
So the skin there is burned and also the underlined muscles.
Yeah, it is not here just epidermis, but deeper in the skin layers. Okay, and how it looks like? Okay, it affects the skin deeper.
We can have necrosis of the tissue.
We can have necrosis, and in 4th degree,
it's completely destroyed, like death.
Absolutely. First of all, the 4th degree, it means that the person is not alive.
Yeah.
Yeah. It is carbonization. The person is carbonized. I'm sorry, I forgot to check the chat, Yusef, and the others. So the 4th degree means that the person is dead. It is also called carbonizatio. The 4th degree in Latin. We have carbonized tissues, black tissues, and it is typical here for the person to be in a pose of a boxer. Why? Carbonized corpses are in pose of a boxer? Because after that, the muscles constrictors, rigor mortis, it is the same. The reason is the same, Yosef. Because after that, the flexor muscles dominate, and that's why the pose is like a boxer. Yeah. Okay. These are the 4 degree of the local effect of high temperature. This is combustion. General effect of high temperature is like heat shock, and this is hyperthermia or overheating, and it is what? Heat shock, hyperthermia. Hyper, yeah. What is heat shock or hyperthermia?
There is like high temperature to the person, like there is
over 40 degrees, yeah, and
weakness of the person, like
how the skin looks like. Everyone of us
Red.
was
Red.
from the sea in summer, and what, the skin is red.
Redness, burn, like,
Mm-hmm.
and without there is no, how is it? Without water, let's say, well, like without.
It is dehydrated.
Dehydrated, yeah, exactly.
Yeah. Yeah. Okay. If what is the main reason for death here? If heat shock continues over time,
we can have the coagulation.
Okay. And yeah, Yosef, the denaturation of brain proteins. Okay.
Could be also respiratory failure.
Yes, and heart failure.
And heart failure, yeah.
Yeah. Okay. Okay. When we talk about fires, for example, here in Bulgaria, before 2 or 3 months ago, one bus was burnt. If you remember, with 40 persons that. Do you remember the
Yeah, I'm
incident?
trying to scope.
Yeah. What is the reason here for that? From what these people died?
Carbon monoxide.
Absolutely, they were not carbonized from the local effects of the high temperature, but from the gas inhalation, exactly, Sotiris.
No,
The other Sotiris, and from asphyxiation with carbon
monoxide.
Carbon monoxide, absolutely. So in cases of fires, the first of, well, if the fire continues, the main reason for that here, the very first reason for that is poisoning with carbon monoxide, and of course the corpses will be carbonized, etc. But the very main reason for that will be poisoning with carbon monoxide. Okay, let's talk about low temperature. It wasn't an explosion. What do you mean, Yosef? About the bus accident? Or?
Yeah, I think he means about the bus accident.
Yeah. Well, it was there was an explosion, but the corpses. Well, in cases of explosion, we always also have chemical action of gases, etc. The corpses weren't burnt. Well, carbon. Some of them were carbonized, but the very first reason for that is poisoning with carbon monoxide. Let's talk about low temperature. First of all, local effects of low temperature. They are basically almost the same as the degrees of high temperature.
Redness of the skin.
The first of all, the very first degree is how. First of all, the local action is called congelatio. Yes, Michaelis. Congelatio. The very first degree is also redness, and it is called congelatio erythematosa. Yeah, I told you it is the same basically. The second degree
The
is
second degree
Congelatio bullosa.
bullosa.
The opposite. Yeah.
Yeah, because there are also formed blisters with exudate. Okay, the third degree.
Gangrenosa.
Yeah, gangrenosa. We have here the deeper affected skin, and the 4 degrees necrotica. It is necrosis of the soft tissues. Okay, what are the general effects of the low temperature? These were the local ones, but general effects are hypothermia. It is the basically the opposite of hyperthermia, so hypothermia. Okay, what the why the people die from hypothermia, especially in winter?
Maybe the heart is not working.
Well, yeah, the heart stops, but we have tissue hypoxia.
Yeah.
First of all, okay. What else? We have hypoxia, yeah, Panagiota. We have disorder of metabolic processes.
Mm-hmm.
Okay. Actually, the brain is more sensitive than of hypoxia than hypothermia. I'm sorry, than the heart. So the brain dies first.
Okay.
Yeah. Okay. There is very typical picture of one person died by hypothermia. Very typical picture, clinical picture. How the corpse is found in winter, for example, on the street. Most of the cases, these are homeless people, alcoholics, because ethanol, alcohol, etc. These people, alcoholics, they experience hypothermia more severe than non-alcoholics because of the alcohol. They don't when they are drunk, they don't, it is like they don't feel the coldness. Do you understand this?
Mm-hmm.
They think that that it is hot but not cold, which is because of the alcohol. They feel really warm with alcohol. Exactly. So homeless, alcoholics, these are the main the most often found corpses in winters. Okay. How the clinical picture of the corpse look like?
Like a person that is shivering.
Yeah, okay. What we will find also?
Stiffness in the muscles, the rigor mortis.
Okay, yeah, yes, okay.
The goosebump flesh.
Mm-hmm. Over the nose, what will have?
Redness.
Frost.
Frost, yeah.
Frost.
And very often we will find them undressed because they feel warm and hot, and they put their clothes away, so we find them naked. So this is also a clinical picture of typical clinical picture. And during the autopsy, we can find they are the so-called spots of Vishnevsky, of the name of their founder, Vishnevsky. These are basically spots, brownish red spots. They're over the stomach, but they can be found everywhere where we have serosa on the tissues, but the most common on the stomach. These are brown red spots, dot spots on the stomach. This is a typical autopsy finding. Okay. About the low and the high temperature, I think this is absolutely enough to know about it for the exam. Do you have any questions?
No, thank you. Everything is clear.
So let's talk about what
Electro trauma.
Okay, electro trauma. Let me see just how the question is it divided from the atmosphere electricity, or it is in one question. Disorders and causes of electro trauma: death and death from atmospheric atmospheric electricity. Okay, let's talk about electro trauma. It is called in Latin how? Electrocutio. Yeah. In most of the cases, these are accidents because of the old electricity
wires,
devices in home. So in most of the cases, these are accidents. When we talk about electrocution, and this is basically what do you have to know about this trauma? You don't have to know about the effects of electricity. This is so many physics in this. We don't really want these things. You should know that it has electricity has thermal action, it has mechanical action, it has electrolytic action. This is the three actions of the electricity. The first of all, the electricity, when acted on the body, we will find damages on the skin. The very first thing, the damages on the skin. The clothes will be teared. Also, it is very, very typical for the hair to be curled because of the thermal and electrolytical action of the electricity. The hair not only on the skin, on the head, but on the genitalia, etc. It will be curled from the electrolytic and thermal and burnt, curled and burnt because of the thermal and the electrolytic action of electricity. Also, you should know here why the person dies from the electricity. For example, when you perform a cardiopulmonary resuscitation and you use electroshock, why do you use it? Why it is used electroshock?
To rework the heart.
In what way?
To restart it with
These pulses.
To get it from arrhythmia, Yusef.
It has to do
Not
with the
from
SA
arrhythmia,
node and AV node.
Can you repeat?
It has to do with the SA node and AV node. That's the point we need to give the electricity to.
They give some electric pulse.
Electric pulse, okay. It can suppress or, well, it is used to excite or express the vital functions of the. I'm sorry, just to open the door. Oh. Какво? Съжалявам. Okay. Fibrillation. Yeah. Okay. So, this is the effect of electricity. It can cause suppress of the functions, or when, for example, when we use electroshock, it not suppress, but what? The opposite.
enhance.
Yeah.
Enhance.
The vitality of the heart and the vital functions. Okay. So, what? Какво бе, Тодоре?
Нагази копката в калта.
Нищо изтрия. Почистия, т.е. I'm sorry. So, what are the causes of death when we talk about the effect of electricity?
Shock.
Electric shock. Okay.
Heart attack. Yeah.
Also, respiratory center are blocked.
Absolutely. These are the three very, very first causes, early causes of death. And the late, the late causes of death.
Like
blood
crash
loss,
syndrome.
Because of when, for example, some vessels are ruptured or organs are ruptured, we can have these conditions, and in these cases, the late cause of death will be blood loss, hemorrhage. What are we're talking here about late causes of death. Embolias and stroke, they principally they generally are immediate cause of death, but not in cases of electricity trauma. Yeah, Yusef. I'm talking to Yusef. Какво? Кажи де. Okay, how the corpse look like?
We have like spikes, like the electrical signs.
Yeah, what they why they are, Why is that? What are the electrical signs? Do you understand how they are formed?
The electricals on the body.
On the body, yeah, on the place, on the spot of the body where the electricity acts morphologically. What are the electrical signs? They are reddish. They are reddish, and they have we can have some, for example, metal particles. If this part of the body is was with the contact with, for example, the old electricity device, because of the melting of the metal. So we can have deposits of such metal particles of the device, but this is not necessary to. It is not necessary.
It's not a necessity.
It is not necessary to have this. But we can have reddish spot. Какво? Кажи бе, Тодоре. We can have a reddish spot on the body where the electricity was acted, and
burns.
It's swollen.
Burns. Okay, the skin can be swollen.
If there is hair, the hair will be like.
We can have a necrosis, center of necrosis, on this part of the body. Yeah. We can have blisters also, but most of the times the skin is dry, and we have necrosis on the center with black center, necrosis with black center. Okay, and about atmospheric electricity.
The lightnings.
Lightnings. In Latin, we call this
fulminatio.
Fulminatio, yeah.
This is not fair for the Italians.
In most of the...
I'm sorry.
In most cases, in 100% of the cases, these are accidents. And actually, the corpse picture, the dead picture, is not very special. And in most of the cases, when we have suspicion of fulminatio, of lightning injury, we put the diagnosis by when we eliminate any other reason for death. First of all, it is very important to know the anamnesis of the patient, that he experienced atmospheric injury, and it is very important to investigate the crime scene here, because when we have fulminatio and lightnings, the surroundings will be affected also. Some trees, burnt trees, we will have damages on the buildings. Also, if the person have inside his clothes some metal objects or coins, they will be damaged also, not melted but damaged. So this is also a material evidence in these cases, and it is important to examine these the clothes, the objects that the person had with himself during the injury. And this is we put such forensic diagnose, fulminatio, when we eliminate the other reasons of death, and when we investigate the crime scene, we see all these damaged coins, clothes, burnt trees, buildings, etc. But on the external part of the body of the corpse, what we can find? We can find basically the same as when we have electrocution. We will have burns of the clothes. We will have burns of the body, hair. We can have curves, hair curved, curl hair. I'm sorry. What can we can find? It is common picture. We I don't know how it's called in English. I'm sorry. Because of the melting of the blood vessels, because of the fulminatio, we can have imprint of the blood vessels outside of the skin, and this is very common in the place of act of the electricity, of the lightning. Imprint of the blood vessels on the superficial layer of the skin. Did you understand this? I don't think that it has a term in English, but thundering figures, something like this. Because of the melting and not melting, but the enlargement of the blood vessels on the place where the lightning acts on the body. The blood vessels, they are enlarged, and they are basically on the superficial layer of the skin. They imprint, and they can be seen on the outside. Do you imagine this?
Yes.
Like a branch tree on the skin from the blood vessels.
Yep.
Okay. If you open the lecture on the which page? Page a slide actually 45 and 46. This is what I meant. Like an X-ray on the skin. Yes, you said. Okay. What other questions we have to discuss? Let me just see. Barotrauma. What is barotrauma? And radiation trauma. Barotrauma, it is because of changes of barometric pressure. By pressure, yes. Basically, two types. When we have increase in barometric pressure, and when we have decreased pressure, we have you have learned these diseases, but just give examples. When we have increased atmospheric pressure, what kind of diseases?
with the diving.
Okay, and when we have decreased,
is in the mountains.
Yes. Okay. Do you know these diseases?
Yeah.
You can learn this. This is nothing forensic here. These are you have learned this in your internal diseases course, etc.
Yeah,
let's talk about
let's go a little
asphyxia.
bit faster because it's 8:30 and we are.
I know. Radiation. You have you all have seen and read about Chernobyl.
Yeah.
What is the main reason for that when we have radiation?
Leukemia.
Okay, tumors,
late phase,
leukemia, bleedings,
and teratogenesis.
Okay.
Also burnings.
Okay, let's talk about asphyxia. How many types of asphyxia do you know? And actually, what is asphyxia?
Asphyxia is the lack of the oxygen.
Lack of oxygen. Okay. For forensic practice, we discuss mechanical asphyxia. How many types of mechanical asphyxia do you know?
3: hanging, strangulation, and manual strangulation.
3 of, I think there are more. 4. First of all is strangulation.
Compression.
Okay.
Yeah.
Compression of the body, obstruction, and narrow enclosure. Okay, let's start with strangulation because this is the most important. What are the 3 types of strangulation? There are 3 types of neck strangulation. On the neck, asphyxia on the neck.
Like the manual one is one.
The first of all is?
Manual.
Okay.
Hanging.
And the ligature one, the one with someone else with
Absolutely.
a rope.
What is the difference between these two?
The ligature is the one that someone else is giving to another, but by like a rope, for example, or the manual one instead is just by the ends of someone else around the neck. And instead for the hanging is suicidal attempt.
In 99% of the cases, it is a suicide, yeah. And it is because of
the weight of the person.
Of the weight of the person. Okay. When we have manual strangulation, do we have cases of suicides? Can we perform a suicide by manual strangulation?
Absolutely not.
No.
Absolutely not. Okay. Okay. How is the morphological picture? What is the morphological picture in cases of strangulation?
We have like the imprints of the hands, like the bruising of finger shapes.
Yes, when we have manual strangulation, but I meant in general when we have. Well, let's say first of all, what is the morphological picture of asphyxia generally? How is what is the morphological picture in corpses? I mean,
inside or outside?
And let's start from the outside.
Not in the autopsy, I mean.
Yes, outside of the body before the autopsy. On the crime scene, for example, how the dead person
There is fighting.
looks like.
Yeah, it's fighting in the corp or out in the skin. You mean the skin?
I mean outside the body, macroscopically. I mean cyanosis on the skin. This is what I mean.
Yeah, cyanosis of the skin.
And
maybe there is like a fighting, so maybe there is trauma in the body, or
well, it depends on the case and type of asphyxia, but okay, but this is not so typical for the mechanical asphyxia. The very first is cyanosis.
Yeah.
What else?
We see like some small red purple spots around the eyes.
Okay. Not just on the eyes, but on the face. In general. Okay, how the eyelids would look like.
There is
And
rupture
eyes.
of the vessel.
What?
Rupture of the vessel in the eyelids. Like
rupture of the vessels. Yes, especially in strangulation type of asphyxia. Okay, but we will have exophthalm and enlargement, edema of eyelids. Okay. What? How the post-mortem spots would look like? They will be dark reddish post-mortem patches. Okay, and in the and during the autopsy on the inside, on the internal organs, how they would look like?
We will find in the lungs.
How the lungs would look like? First of all, it depends on the type of asphyxia, but they will be
cyanotic also. Like more.
They will be
collapsed.
They will be collapsed, but we will have also a lung edema. They will be collapsed, but like a compensatory mechanism, not because of the lack of oxygen. It will have we will have lung edema, brain edema. The dark the blood will be dark and liquid. What else? The spleen, how it would look like, the spleen.
Edema even here?
No, you know that spleen is what?
A filter organ.
And it is like a reserve storage of the blood, right? And because of the lack of oxygen, the spleen starts to work continuously and to push out blood, and that's why it will be collapsed. It will be small. The spleen will be small and anemic, and this is called a sign of Sabinski. Do you understand why? Because of lack of oxygen, and oxygen is what? How it is transported by what?
Red blood cells.
Absolutely. And that's why the spleen starts to work excessively. And it is collapsed, it is anemic, it is smaller in size, and this is called a sign of Sabinsky. It is typical morphological picture. Okay, in cases of strangulation, we have also typical neck clinical picture, morphological picture on the neck in cases of strangulation. First of all, we will have what on the outside.
It depends if we are speaking about hanging or if we are speaking about manual strangulation.
Okay, about hanging. Manual, it is obvious what we will find with them when we have manual strangulation, but
we will have
when we have hanging on the outside, we will have
arrows like the sign of the rope that is
sign
more
of,
evident,
absolutely,
more
line of
on
rope.
the side where it hangs.
Okay.
It can be also inside on the inner layer, let's say.
Okay.
It depends also on how many loops there are.
Yeah, if they are double, if they are two, the loop will be the imprint will be doubled, for example.
And there is also the so-called comb between the different.
Absolutely, between the two
loops.
The two loops. Okay, it is called comb. Yeah. On the outside, when we make dissection, what we will find in case of hanging? What is broken? What is fractured?
The first cranial vertebra.
No.
The sternocleidomastoideo muscle can be ruptured.
Yes, Yusef. The hyoid bond. Как се казваше катозична кост? Let me just see how it was called in English. Потезична кост. Sublingual bone, but I think it had different name. Well, yeah, parts of the sublingual bone and also of the thyroid cartilage. They can be broken very often when we have hanging. Okay.
Can I ask you a question?
Yes.
I thought also the atlas and axis are broken. That's the reason why you say, the typical hangman fractures.
They can be broken, but
it's not typical.
It is more common to have fracture on the thyroid cartilage and sublingual bone.
Okay, thank you.
Yes. It is very, very often. Okay. Another type of asphyxia. Asphyxia by compression of the chest or of the abdomen. Tell me about this. When we have asphyxia in chest and abdomen. First of all, the death here is not fast. Because, for example, when we have strangulation, the death occurs very soon after the injury, the asphyxia. But when we have asphyxia, compression asphyxia, the death occurs a little later. On the
There is also
internal,
exophthalmia and cyanosis of the face.
and on the internal organs, how they would look like, what injuries we can find.
Like they can be compressed, for example, in the chest cavity, we can have like pneumothorax, hemothorax also.
We can have also broken ribs.
Yes, the pneumothorax and hemothorax due to the broken ribs event.
Okay.
And the same for the abdomen, like we can have type of injuries on stomach, intestines, because they are cavities anyway. It depends always on the weight of what gives the compression.
Yeah. Okay. It is not necessary to have traumatic injuries to internal organs or fractures, etc. But it is common to have this. How the lungs would look like? How the lungs would look like?
Reddish.
Reddish, and it is also called
carmine
lung. It comes from Latin, or because I have learned Spanish, I think in Italian it is the same. Carne means meat, so this is where the carmine lung is.
We have also color called the carminio.
Yeah. Okay. So with this red color, the lungs appear. Okay. What do you know about choking? What is choking?
It's always a type of asphyxia, but due to obstruction of the airways.
You are studying right now pediatrics. What
Yeah.
is the main reason of choking when we talk about kids?
They eating things, so it blocks the
nuts mostly.
Needs beans. Why beans? Because beans, when they
become larger.
Yes, and they block the airways. So choking, especially in children. Of course, this is cases. These are cases of accidents. Yeah, and what can you tell me more about choking? In adults, accidents are most of the time because of fast eating, for example, not swallowing the food, not the whole food. Okay. Not just food, but foreign bodies at all.
Yeah, like batteries or the things that they play with.
Okay, what about drowning? In Latin, eating and talking at the same time. Yes, Yusuf. Don't do it. Eating and talking at the same time.
This with the liquid, the same, but with
the liquid. Yes. How it is called in Latin?
Submersio.
Submersio. Okay, or Italian. Okay. Not just water. In your lecture, it is written that there are known cases of drowning with wine, brandy, fecal, and etc. So not just water, but when we talk about drowning, we mean asphyxia with liquid. Yeah, with liquid. In most of the cases, it is these are cases of accidents, but there are murders, suicides, etc. What do you have to know about drowning? I'm very tired, so you tell me.
We have to distinguish about the salty water and just the water.
And what is the difference? How a person drowns in salty water and how in fresh water?
I think it's because the high concentration of the salt, and so the organs can like exhale, put out the water, let's say, of the.
Here you're talking about drowning in what water?
Salty water.
Salty water.
So yeah, it's hypotonic and hypertonic, so the exchange of the water is more.
Yes. And when drowning in fresh water?
It's okay.
It's okay.
Yeah. What can we say about that? Like we have hypoxia. And then like people lost the cautiousness. And then die.
Read this tomorrow. Read about drowning.
Yeah.
Let's say the most important things here. How the morphological picture of the corpse look like. What we can find. First of all, it depends how long the corpse was into the water. Right?
Usually one of the typical signs is the foam.
Absolutely. And it is hard, stable,
for
on the nose and on the mouth. Yes. Okay. What else?
If it stays in the water, like we have saponification. It's like this.
It not saponification. Let's say maceration.
Okay.
Maceration of the epidermis.
Yeah.
And yes, it is when the corpse or the person stays longer in the water. It is typical for the hands and legs to be macerated.
Yeah, they stay.
They are called how? Gloves of death and shoes of death. the term. I don't think. I think this is a Bulgarian stupid names. I don't think that in English literature there is such thing as gloves of that. But you should know that the legs and hands they are macerated.
Stiffness of the.
Mm-hmm. Okay.
And it sticks too much.
How can we say that the person has died because of drowning, or he was killed with, for example, with a gun, and the corpse was put
If it's
into the water?
It's from the gun, we'll see the wound, like from the.
Okay. I'm not asking about the wound here.
Do you mean aspiration of water so you can find it in the lungs? So
okay, we can have aspiration of water, but not just water. What we will have? What we will find in the stomach or intestines? Because he was
the morosine.
What?
Like the morosine in the stomach, there is more fluid in the stomach.
Not just fluid. The person will have what? If he had been drowned. He will have what? Plants, sand.
Yeah, I have all this evidence on what we can find in the lake.
Plankton, small insects, like Yusef said. Yes. Okay. What else? There are some microorganisms called Diatomae, which can be microscopically examined, which are signs of drowning, because they live in the sea, in the water, in the sea, and they can be swallowed when drowning. So these are also a sign that it is case of drowning. Okay, what else? Asphyxiation in closed space, enclosure. What can you tell me about this?
Doctor, I didn't hear the question.
The very last type of asphyxia. It is from what?
Kind of oxygen ending in the space where it is.
And in hypercapnia, maybe.
Mm-hmm.
So.
Okay. Hypoxia, hypercapnia, because of lack of oxygen in very small space. And here also the death occurs very, very slowly.
But the patient doesn't see it because there is loss of consciousness easily.
Yes, of course. The very first, the patient loses consciousness.
It's similar to the chimneys one.
Yes, absolutely. Okay, read this question, because we just mentioned some things, but you should read the whole lecture. And also we forgot to tell something about road traffic accidents, but I think that you know these questions about tractor trauma, motorcycle trauma, automobile, and etc. Ask me if you have any questions about this topic.
Doctor, everything was clear. Thank you very much, really.
Yeah, thank you for your time.
And
Thank you.
please, because with some of you we have discussed about abortion, about I'm sorry, I have really exhausted. I can't think right. Absolutely. About abortion, about pregnancy, etc. I think that I asked them to send the question to all of you, what they have written. Do you?
Yes, we will spread them.
Okay. The question was about pregnancy, about abortion.
It was only 2 questions.
Yes, about sexual lack of sexual functions, etc. Please send the questions to all. And ask me if you have any other questions.
I think we are okay. Thank you very much.
No problem. You will take the exam. You know that.
Yeah.
We're sorry because we exhausted you. So.
Oh no, you're not. Absolutely, yes. You're not my problem. My problem is my work, not you. I'm exhausted because of it. Okay. If you have any questions tomorrow, I'm here. You can ask me something. If you want to discuss some other questions, I'm here. It is up to you if you want.
Doctor, can I ask you?
Yes,
do we have these questions that you mentioned with pregnancy and abortion, etc.?
What did you ask? I'm sorry.
Do we have these questions that you mentioned with pregnancy, etc.?
Yes. Identification of sex, reproductive ability. Because they were missing from the syllabus, but
no, it's not.
after
It's number 5 and number 5 is reason of the forensic medical detection of pregnancy, birth of a child, and abortion.
Mm-hmm. Yes.
Yeah.
And sexual crimes,
rape, and so on. It's in the last part.
Let me just open the syllabus.
Yes, it's a part 3. We have them.
Yeah.
Okay. Because they were missing. I think later I have send them to you. But
okay, thank you.
Yes, 4 and 5.
Yeah.
And 6, sexual crimes, fornication and rape. And the 4th and the 5th question, I would ask your colleagues to give them to you. But if you want, let's discuss them very, very shortly.
I will send the pictures of my notes this evening. So if everyone is okay with that.
Yeah.
So we will not bother you because it's late.
Okay. As you wish. And if you have questions on these questions, ask me tomorrow.
Okay. Thank you very much once again, and have a good evening.
Thank you for your time.
Okay, bye.
Bye.
Thank you. Bye.
Bye. And good luck.
Thank you.
We will see each other on the weekend.
Okay.
Bye.
Bye.